Okay, well, welcome everybody. My name is Dr. Lisa Lilienfield. This is a lecture on naturally healthy bones, how to prevent and treat osteoporosis without drugs. And as you'll see, I really enjoy putting pictures into my presentation because they're fun to look at and they're more fun than looking at charts and statistics. So, and I think pictures tell a story and they also invoke some emotion. So for me, this picture, I thought of joy, I thought of freedom and mobility. So I want you to think about that throughout our presentation. So we're going to discuss the definition of osteoporosis and osteopenia and how we diagnose it. We're going to discuss medication management, risks and benefits. Then we'll move on to natural treatments, and then I will do a demonstration. So I'm going to keep you in suspense, but I can tell you that I have yoga socks on and here's a block, so that's a little hint, okay? So what is the definition of osteoporosis? So osteo is bone, porosis is porous bone. So what happens with osteoporosis is there's an excessive loss of protein and minerals, and the bone becomes obviously less dense and weaker, and it's more prone to fracture. In some cases of severe osteoporosis, just a sneeze or a cough can cause a fracture. So there's the three of the most common places for osteoporotic fractures include first the vertebrae. So in what happens with vertebral fractures is the anterior or the front of the vertebrae actually collapses spontaneously in severe osteoporosis. And this causes a further decline in the musculature around the spine, and these individuals are 3 to 5 times more likely to suffer further osteoporotic fractures after the first one. So this is treated basically conservatively just with medications and pain medications, and maybe acupuncture would be helpful. In some cases, a surgical procedure is done called a vertebroplasty or kyphoplasty, where they inject a substance into the vertebrae to restore the height of the vertebrae. But as you can imagine, it sounds good, but there's a lot of complications, especially in the population where this occurs. So you've heard of Dowager's hump. This is the kyphosis, the curvature that occurs with multiple spinal fractures. The second most common place is in the hip. And it's usually so this is the normal hip, and here's the fracture. So usually it occurs in the neck of the femur. So that's the weakest part of the hip. And this can occur with a fall, or if the osteoporosis is severe, it can spontaneously fracture and cause the fall. This is basically treated with surgical pinning. And the third place, most common place for fracture, it's called Colles fracture. And it's usually, there's no fracture here, but this is just the anatomy of the wrist. This is the radius, and this is usually where the fracture occurs with breaking a fall. So the statistics haven't changed much in the last 10 years, and there's about 44 million Americans with osteoporosis or close to osteoporosis. And 1.5 million osteoporotic fractures occur annually. 1 in 2 women and 1 in 4 men over the age of 50 will have an osteoporotic fracture in their lifetime. So this is not just women, but obviously it is more common in women. There's a high mortality, meaning there's 25% of death rate in the first year in usually an elderly person that suffers an osteoporotic fracture of the hip, and 20% will enter a nursing home. So how is it diagnosed? This is a DEXA scan. It's a very low density X-ray. It's so low that the tech doesn't wear a lead apron, nor does the patient. But the X-ray is performed on the spine, on the lumbar spine, and on one of the hips. And it's reported as a T-score. So it's The T-score, you might have heard of that. It's a number that's a standard deviation away from peak bone mass, and we'll review that a little bit later. So this is another picture of the DEXA scan on the hip, and here they're measuring the neck. So they report it as the femur, the T-score of the total hip, and they report it as the T-score on the neck of the femur, because that's the most common place for fracture. But there's another test that can be done, and this is called an osteomark or NTX or Low Peptide, and it's a very easy test. It's a second morning urine, and this is a good way to follow osteoporosis or osteopenia without having to get another DEXA scan earlier than you should. So you can do this every few months, and basically it measures the bone breakdown, the collagen breakdown in the urine. So the range is between 5 and 65, and the ideal range is between 30 and 45. So why isn't the ideal range 5? Because you want some bone turnover to keep the bone vital, and we'll talk about that in a moment. So it's reported as bone collagen equivalent units per millimole of creatinine. The World Health Organization formulated a tool called the FRAX. You can Google this. And this gives you your 10-year risk of developing osteoporotic fractures. So the risk factors, once you do have a DEXA scan, a T-score, once you have that, you can plug in your numbers and answer the questions. So if you're a female, you're more prone to osteoporosis. If you have low body weight or you're Caucasian, you're more prone to osteoporosis. Heavy smoking, heavy alcohol consumption. Someone who's on chronic steroids is more likely to develop osteoporotic fractures. Someone with rheumatoid arthritis. And obviously, if you have a history of an osteoporotic fracture or you have a parent that has an osteoporotic fracture, you're more likely to develop osteoporotic fractures. So, and the low T-score. So it's not just about low bone density. There's other factors that are involved in the risk of fracture. So how is bone made? So there's 3 major cells that I'm going to discuss. And one is called an osteoblast. So whenever you hear blast, it means an immature cell. So the osteoblast actually produces something called osteoid, and it's a protein that is eventually mineralized. The osteoblast then becomes entrapped in the matrix and becomes an osteocyte. The name osteocyte isn't on here, but osteo is bone and cyte means cell, so osteocyte. So the trapped bone cell actually monitors the mineralization of the matrix, and it also has mechanoreceptors, so it senses load on the bone, so it actually can lay down more new bone based on the load on the bone. Osteoclasts actually eat up dead bones, so any bone that is old or not vital, the osteoclast will eat up. Most of the drugs aim at the osteoclast, so slow down the osteoclast, what the osteoclasts do, and that's where most of the drugs are aimed at. There is one drug, and I'll review that, that focuses on the osteoblast to produce more protein. So here is a more simplified version of the bone cells. So the osteoblasts, you can consider they're builders, and the osteocytes are retired builders, but they're not really retired because they're at the computer and they're on the phone communicating with other osteoblasts and other osteocytes and deciding whether more bone should be made and the bone should be mineralized further. And the osteoclast is the digester, so it eats up the dead bone. So there are some cultural differences in osteoporosis and osteoporotic fractures. For example, people of African origin have higher bone density and fewer osteoporotic fractures. On the other hand, Asians tend to have the lowest bone density, But they have fewer osteoporotic fractures than Caucasians. Well, how can that be? So one theory is that culturally there is more focus on exercise from young kids all the way up to the elderly, exercise that promote good posture and balance, like the martial arts and Tai Chi. So also you notice that I have young people. This is not an old person's disease. 25% of your bone density is actually produced in early teenage years, over 2 years. So the average age in girls is 12 and a half, and the average age in boys is 14. So think about how kids eat. You might think that as a health-conscious, holistic physician, my kids probably ate perfectly. So they're in their 20s now, and they're very good eaters now. But I remember when they were teenagers, and once they become independent and they start to make their own decisions, you don't, first of all, they're up late at night, they get up just before school, they skip breakfast. I don't know what they ate at school, but I kind of heard about chips and brownies. And then I remember my son going to Starbucks a lot in high school. Then they play sports. So their nutrition is probably not, most kids do not have great nutrition in teenage years. But when my son was in 4th grade, I did a nutrition lecture for his class, teaching them how to read labels. And this was after the fat-free craze, when everything was fat-free, but they loaded everything with carbohydrates, sugars. So I did educate the kids. And when my daughter became a vegan at age 12, I took her to a dietitian. But in spite of that, they go through their teenage years, and who knows what they're eating. But the message here is that we need to educate our kids, and we need to be role models to our kids. And eventually they do come around, and they realize they practice what they learn. But there are kids that are in sports that promote low body weight. For example, wrestling and gymnastics and ballet. So these kids are at high risk for osteoporosis in the future. It's like having a bone bank. You want them to start to build up their bank in early years. And what about kids or young people who have eating disorders? And it's in women and men. And particularly in women, they can lose their menstrual periods, and their estrogen levels drop down, and this causes more bone turnover, so they're at high risk for osteoporosis. So there's other factors besides bone density, and promoting good posture is very important, because if we're upright, we're less likely to fall, and we're less likely to put pressure on, say, the vertebrae for the vertebrae to collapse. Also, strength training is very important. We do know that strength training stimulates the osteocytes, so resistance training is good for building bone. In addition, the muscles will protect the joints and the bones. In addition, also balance is extremely important. So we have these nerves called proprioceptive nerves in our muscles and tendons, and they tell where we are in space. And these things can be developed with balance training. So as one gets older, they might lose their vision, or their vision may deteriorate. Maybe the inner ear, which has to do with balance, there's a problem there. They may be on medications that cause sedation or dizziness or lower their blood pressure. So this all contributes to falls. The proprioception can be developed, so that is very important. Now, there was a study done, a Swedish study that was published in 2005. They took 2,400 twins, and of these twins, one twin reported, it was basically interviews, twin reported that they didn't feel like they had any problem with balance, and the other twin reported that they felt they did have a problem with balance. They followed these twins over a 5-year period of time, and there were 3 times as many osteoporotic fractures in those that felt that they had balance issues, probably more falls. So the assumption is they had equal bone density, but the issue with balance and falling caused more fractures.